Now that COVID isn't such a huge concern, I'd love to cover a topic that I haven't been able to because that's been the most popular topic of all. And it is which infections are most likely while on prednisone. And this study I'm going to cover today happened before COVID, so we're not going to talk about that. We're done talking about that. We don't talk about COVID. Not today. So, which other infections are most likely while on prednisone? So this study was done in the UK, and they looked at which in people who took prednisone got an infection compared to normal people who aren't taking prednisone. And these are the diseases that they were looking at, people who had these certain diagnoses. They had asthma, COPD, rheumatoid arthritis, inflammatory bowel disease, polymyalgia rheumatica, cancer, or connective tissue disease. And so only people with those conditions is what they were studying to see which infections they got while taking prednisone for those conditions. So of those, they found that within the first 2 weeks, the most likely infection to happen is pneumonia, a lower respiratory tract infection. And that's the most likely thing that will actually kill you while on prednisone. And so then the next thing that you're most likely to get is called local candidiasis, which is also known as a yeast infection, like a white film along the mucous membranes, back of the throat, maybe the tongue even. And it can also be in other places on your skin and other strange places. That would be a yeast infection. So those are the first two most likely at any time, but especially in the first 2 weeks. Then the next three I'm going to cover can happen at any time while on prednisone. And that's septicemia. And that's actually a bacterial infection that's all over the whole body. It's not just limited to like your lungs, your nose or something. It's in your blood. It's all over. And that also can potentially kill. And so that's a big problem if that happens. And then cellulitis, that's a skin infection of bacteria. And so with both of these, they're going to have to give you IV antibiotics, which is not at all fun. And then the fifth one is herpes zoster, which is another fancy word for shingles. And so if you got chickenpox as a child, it can reactivate because you're immunosuppressed, and the virus that's been hiding in your nerve endings can just reactivate and give you some seriously miserable pain. So those are the 5 most likely to actually happen while you're taking prednisone for the infections. Infections that they couldn't find a difference between otherwise healthy people who aren't taking steroids is varicella, dermatophytosis, and scabies. You're as likely to get that whether you're taking prednisone or not. So what can we possibly do about these potentially life-threatening complications and side effects of prednisone? And first of all, doctors can be very aware that those are what to look for. But what can we do as prednisone patients, right? Excuse me. So first, stay close in contact with your doctor. If you're having any symptoms like me coughing, that's not a good sign because that could be a sign of pneumonia, right? And so what can we do to prevent pneumonia from becoming a bad outcome? So the two most likely things you're going to get infected with that kills you with pneumonia, you can prevent with, dun, 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 a vaccine. And so if you haven't already gotten your influenza vaccine every season and a pneumococcus vaccine, if you're a certain age group or if you're certain disease states, you can qualify for it younger. But I think it's over 60 people can get the pneumococcus vaccine. Like the most common one is Pneumovax, and then the flu vaccine every season. And that way it'll protect you from potentially dying of pneumonia because that's your most likely complication from having taken prednisone. And then for the yeast infections, it's checking your mucous membranes in your mouth, having make sure your doctor checks for that in your mouth, the back of your throat, maybe your feet or other areas that can be moist. That's where yeast likes to grow. So those are some ways you can prevent the most common infections while you are on prednisone. let me know what other things you're wondering about while you're taking prednisone. Just comment below. And if you liked this, I appreciate you showing your appreciation by giving it a thumbs up, like, subscribe. And finally, if you want more information like this is just a tiny bit of the tips that I share. Excuse me, my voice is so weird. The tips that I share in my prednisone checklist. It contains this same information plus a whole bunch more for all of the worst side effects that prednisone causes and what you can actually do to combat them. So if you'd like a copy, just click the link below and you can get a copy of the prednisone checklist. Signing off as your prednisone pharmacist, Dr. Megan.